Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. 3 additional laboratories activated by the NCDC, bringing the total number of laboratories with capacity to test for COVID-19 in Nigeria to 33. Edo government bans political gatherings of more than 20 people as state fights to keep COVID-19 figures low. And over 7 million confirmed cases of coronavirus reported across the globe, along with over 400,000 deaths. That's according to the Johns Hopkins COVID-19 Resource Center. We begin with the Nigeria Center for Disease Control, NCDC, activating 3 additional laboratories for inclusion in the NCDC molecular lab network in 3 states in Nigeria, bringing the total number of labs with capacity to test for COVID-19 nationwide to 33. The centers are located in Ibadan, the Oyo State capital, the Biorepository and Clinical Virology Lab, UCH, the Test Tube Molecular Diagnostics Lab, Infectious Disease Unit, General Hospital, Ituk, Akwa Ibom, and in Dutse, the Jigawa State capital, a Test Tube Molecular Lab as well. According to the center, others are still in progress, and some of them are in Kwara, Gombe, Ekiti, Ondo, and Abia states. In the meantime, the center recorded 315 new confirmed cases on the 8th of June, and 7 deaths were recorded on that day as well, bringing the total confirmed case figures in Nigeria at 12,801, with over 4,000 cases discharged and 361 deaths recorded in 35 states and the Federal Capital Territory. Of the top 5 states with COVID-19, Lagos has recorded 72 deaths, Kano 49 deaths, the FCT 23 deaths, Edo 24 deaths, and Katsina 21. The top 5 states have also seen a high number of recoveries. A breakdown by region shows Lagos in the southwest with the highest positive cases in the country, a total of 5,895 cases, followed by Kano in the northwest with 1,004 cases. The FCT leads in the north center with 986 cases. Edo leads in the south-south with 429 cases. Borno retains its number of cases, 356, but comes top in the northeast, while Ebonyi leads in the southeast, but cases unchanged at 103. The Edo State government has reiterated the ban on all political and social gatherings of more than 20 persons in line with some of the recommendations of the safety guidelines on the coronavirus pandemic. The chairman of Edo COVID-19 response team, Mr. Philip Shaibu, at the government house said all political parties must seek explicit approval for use of the Samuel Ogbemudia Stadium, which is the only approved venue for political activities.
Just recently, we got a letter and the governor approved the use of Samuel Ogbemudia Stadium for your party, the PDP. It shows that your party is obeying the rules and regulations set by the state government. So I also use this opportunity to tell other political parties to abide by the gazette that has been gazetted in the state. That is the law of the land now. And just like you have obeyed, we are also asking other political parties, they must obey. It's a law. It's not, we are not appealing to them or appealing to their conscience. We are only informing them that there is a law in place and which must be followed. PDP has obeyed that law by writing to the governor, and the governor has graciously approved the use of that stadium for your primaries. So I'm sure other political parties will follow suit. And any political party that will disobey that order will not have the state to do its primaries, because there is a law and that law must be obeyed. The life of our people is far, far, far more than our individual political ambition. the lives of our people is far more than anything we want to achieve individually. Because we need to be alive to even play the politics. We need to be alive to be voted for. We need to be alive to even be the voter that is going to vote.
And more survivors are narrating their experiences, this time from Delta State, where a lady, a survivor of COVID-19, was being discharged after undergoing treatment at one of the isolation centers in Delta State. She had expressed some of the symptoms that she felt, feverish, loss of smell and taste, some of the symptoms of COVID-19, but then after testing negative twice, she's been allowed to go home.
Congratulations! 30-year-old Ofure Okifo is one of those who have survived the battle against COVID-19.
You have had at least 3 days without symptoms. Your oxygen saturation has been more than 95% in room air for more than 30 days. You have exceeded 14 days after the initial positive result, and your PCRO is now negative.
After testing positive for the virus, she spent close to 2 weeks at the Asaba Central Hospital Isolation and Treatment Center.
This virus is very real. It is not a scam like most people think. It is very, very real. And I would also want them to listen to what the government says. They should wash their hands regularly, maintain social distancing.
The battle is over and she's free to go home. There are over 10 patients still being treated in this facility, and they are hoping that someday they will be out. But the state government is asking residents to take the health guidelines seriously.
We run as a country run the risk of having to become overwhelmed like it is in the advanced world. We pray that doesn't happen, and that's why we're insisting that our people continue to observe all the health protocols that are very well established, so that at the end of the day, we are all able to curb the spread.
Unfortunately, Ofure's story and that of other survivors may have fallen on deaf ears. Now, the State Task Force on COVID-19 has clamped down on some popular hotels and bars in Asaba, sealing up some of them for flouting the rules on social distancing and other guidelines to check the spread of the virus. The state government is not happy with the situation and is warning them to adhere to the directives.
For those of them that flouted the order or the directives, we sealed up some parts of their hotel. For those that we didn't have any problems with, we just had a chat with them. But our appeal to everybody is to please ensure that you take this matter very seriously.
COVID-19 is real. This has been the message coming from the government and health personnel. The Delta State government insists health guidelines must be followed strictly to contain the virus.
Now, countries around the world are working to flatten the curve of the coronavirus pandemic, and flattening the curve involves reducing the number of new COVID-19 cases from one day to the next. Let's find out how states are responding in Nigeria. And Dr. Hassan Sule of the Department of Public Health and head of the Clinic, National Open University of Nigeria, joins us on the program. We'd like to welcome you, Dr. Sule. Thank you for joining us on the program.
Thank you very much.
All right, Dr. Sule.
Thanks for having me.
When a country has fewer new COVID-19 cases emerging today than it did on a previous day, can we conclude that the country is flattening the curve?
Well, yeah, it's more complicated than that because you would have to go longer than 1 or 2 days with less infections before we conclude that the curve is flattening. What we're talking about is the infection rate. That's the number of people an infected person potentially infects. So, which is also called the R rate. If that number goes below 1 over a period of time, then we're sure that the infection rates are coming down and we're on a positive trajectory.
So give us
so
your
as
view.
is the case with Nigeria, we've seen cases go up, number of new cases rise and fall, and then rise again. So we're in a pattern, we're in a swinging pattern, and we cannot exactly say that we're flattening the curve.
Indeed. So perhaps since we're seeing the rise and fall, how do we assess the efforts of the NCDC, the PTF on COVID-19, other stakeholders who are trying to make sure that they curb the spread of the virus?
Well, on their part, I've seen their protocols. It's made public, and their announcements are public. On their part, I think they're doing all they need to do, and they've done well. However, while this is a disease, and what the NCDC puts out is scientific information, people also have a role to play. But then again, with COVID-19, we see that economics come into play. It's a disease. We've been on lockdown for getting 3 months right now, and people have to go out to work and get sustenance. So in doing that, there is the chance, and I think which is very important, there is the chance that people come in contact with the virus, and so we have sustained community transmission of this virus. So on the one hand, they are doing well enough, but on the other hand, there is the people part to it, which is a tricky thing. I mean, it's a balance we need to get as a society, balance of having sustenance and keeping away from spreading the virus. But on the whole, the NCDC, looking at the indices, they've increased their testing capacity. They've been able to train thousands of manpower to help curtail the infection. And then, of course, the PTF, Presidential Task Force, working in concert with state governments, have been able to impose necessary measures which will help slow down the spread of the virus. So at best, it's a balance, which I think we're gradually getting to a point where we reach balance, but we're not there yet.
Okay, perhaps finally, we're having more molecular laboratories from what we used to have to 33 now. Does more molecular labs mean more testing? Do you think we can reach our 2 million target in 3 months, or 50,000 tests per state in Nigeria?
Well, there's a lot of those targets depend on a lot of factors, availability of the reagents and the machines you need for those tests to achieve those targets, because we're also in a situation where there is demand for these machines and these reagents from virtually every country on earth. So possibly the federal government, the Presidential Task Force on COVID-19 and the NCDC working together, possibly I see a possibility of them increasing their capacity, but to reach 2 million tests per day, that remains to be seen.
All right. 2 million in 3 months. Well, thank you so much, Dr. Hassan Sule, the Department of Public Health, Head of Clinic, National Open University in Nigeria. Thanks for joining us on the program. So to come on the COVID-19 updates, asymptomatic spread of COVID-19 very rare. Some current data suggests that they are not likely a main driver of new infections. That's in a moment. Still discussing ways in which we can curb the spread of COVID-19 in Nigeria. And joining us from Abuja studios is Dr. Abraham Amolo. He is a clinical pharmacist and public health nutritionist at the State House Medical Center, Abuja. Thank you for joining us on the program. First, I'd like to get your point of view. We're hearing the federal government taking companies like pharmacies, supermarkets that are inflating prices of key hygiene products needed to fight this pandemic. Do you think that this is something we can avoid this period, seeing as there appears to be a lot of demand for some of these products?
Yeah, well, thank you very much. I'm glad that you mentioned a lot of demand on this product. permit me to mention that the market forces is a major determinant of the price of products. So in other words, if the higher the demand of a product, the higher the price. And the higher the supply of the products, the lower the prices of those products. So what we are trying to say in essence is, once these products are made available, of course, the prices will be low. And of course, that will ensure that they are available when they are needed. What we are experiencing at the moment, of course, is just a true reflection of the increase in the demand of these products. Before now, of course, sometimes in January, you agree with me that the price of all these products that we're using for this prevention of this COVID virus, they are very cheap and readily available and affordable. But what we are experiencing right now is basically on the fact that the supply is low, the demand is on the increase. Of course, everybody wants hand sanitizer, everybody wants the face mask, and because of the pressure and where the number of those that need this product does not translate to the availability of the product. Therefore, the market forces must be put in place to ensure that there is a balance. Otherwise, the products will continue to be on the increase in terms of the prices.
Which doesn't also mean that, pharmacists shouldn't take undue advantage of this by hiking the prices of some of these goods. But you've been following the level of infection of COVID-19 across states in Nigeria. What pharmaceutical or perhaps non-pharmaceutical interventions, what do you make of the response with some of those interventions you've seen?
Well, looking at the response, both pharmaceutical and non-pharmaceutical intervention, of course, I would look at it from 2 points of view, which may be the short term and the long term. Well, of course, what we are seeing in practice in terms of the short term is basically the prevention. Prevention in the sense that, of course, we've been told different methods of preventing this virus, which include hand washing, which also include the use of hand sanitizer, which is that contains the minimum concentration of alcohol. So that means the hand sanitizer must contain the minimum concentration of alcohol, which has been stipulated by WHO to be minimum of 60% of alcohol. Then another form of intervention again is the use of the face mask to prevent the droplets of this virus from the person that is infected to the person that is not infected. So all these pharmaceutical and non-pharmaceutical products put together, of course, if we take a good understanding of the method of preventing this virus, of course, that will go a long way in bringing down our numbers. In terms of the long-term strategy, of course, we've seen different forms of interventions coming up. We've seen various drugs coming up on the market, different claims, and of course, a lot of studies are ongoing on the use of specific molecules in the management of this virus. We've seen the case of the Madagascar COVID organics. We've also seen the recent development by the NIPRID, that's it is the National Institute for Pharmaceutical Research Development. Sometimes last week that came up with their NIPRID Immune. Of course, we've also heard about the use of chloroquine or hydroxychloroquine in the treatment of in the management of this virus. So different forms of interventions. And of course, we've seen a lot of vaccines coming up. But suffice to know that with all this, as we speak today, we don't have a cure for this virus. All we are advocating for now is the prevention. WHO has stated that it will take a minimum of 1 year for the vaccine to come up. So what do? We must ensure strict adherence to all the preventive measures, both pharmaceutical and non-pharmaceutical method of intervention for the prevention and management of the COVID virus.
As a public health nutritionist, if you were to advise with regards to nutrition interventions, what people can start eating to fortify the immune system from coronavirus, what would it be?
Basically, as a public health nutritionist, well, I would basically advocate for a balanced diet. And what is a balanced diet? It's a diet that contains both micro and macronutrients in specific amounts that will nourish the body. We have different types of food combinations depending on the culture that have been proven to be of a balanced diet. Now, what is basically of importance is to ensure that the food contains both minerals, vitamins, and both macro and macronutrients. And of course, we know that, of course, once you have a food combination that contains all this, of course, the effect is to nourish the body and also to build the body and also to reduce, or of course, to improve the immune system. A lot have been said about this virus in relation to the body immunity. And of course, we have seen in practice where most of these herbal products or the phytomedicines that have been produced has to do with immune modulation. And what I was talking about in essence, these are herbal preparations, and what do? They tend to boost the immune system. So this virus, of course, is inflammatory. This virus, of course, little is known about it. This virus is an irony virus, as I can put it. But of course, we know that with a balanced diet, of course, we are exposed, or we have access to micronutrients, which are basic. And of course, we have access to micronutrients such as selenium, such as zinc, that are capable of mopping up free radicals. So it is important for us to note that from public health or nutrition point of view, that the need for balanced diet in the management of this disease condition or for this virus cannot be overemphasized.
All right, Dr. Abraham Amolo, clinical pharmacist, public health nutritionist at the State House Medical Center, Abuja. Thank you for joining us on the program.
Thank you very much.
And the COVID-19 crisis reached its latest tragic milestone yesterday with 136,000 confirmed cases reported in one day, the most in a single day so far. According to the Director General, Dr. Tedros Ghebreyesus, nearly 75% of those cases were from 10 countries, mostly in the Americas and South Asia. Cases have topped 100,000 for 9 of the past 10 days. This is also coming on the heels as the WHO COVID-19 lead clarifies a symptomatic transmission comment that asymptomatic transmission is rare globally, but clarified it to say that she made about saying that the amount of transmission from people with no symptoms is unknown. And from 4 to a current, we have 33 now. We've seen significant progress talking about the response to COVID-19 in Nigeria. From the Nigeria Center for Disease Control, 80% of cases present with mild to moderate symptoms, and they're advising Nigerians to take responsibility by adhering to the recommended measures. You can find the latest guide on their website as the center continues to work closely with states, setting up treatment centers, training health workers to manage COVID-19 patients to recovery. Also, the World Health Organization, it has the latest updates on the global response to the COVID-19 strategy, even though the body is saying that the global situation is worsening. But indeed, you can find the strategic action, practical guidance for strategic action tailored to local context. Our website, channelstv.com, indeed also has more updates. You can find the latest on the pandemic in Nigeria across the world, plus other stories. That is channelstv.com. Well, that's the COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.